How's this? Good, good sound. Okay. This meeting is called to order. Good morning and welcome. This is our May SEB Board meeting. Our meetings this year are going to continue to be hybrid. Healthcare Authority staff will be on site when possible, and board members and other attendees have the option of attending on site or via Zoom. For our Zoom attendees, our opening slide has information on how attendees can turn on closed captioning subtitles. We're going to go through roll call. Then we'll start with Carrie.
Good morning.
Pamela.
Good morning.
Amit. Not with us yet? Okay. Donna.
I'm here.
Amy.
Good morning.
Terry. Myra.
Good morning.
Allison. All right. And we have Katie Hatfield from the AG's office.
Hello.
And I'm Lou McDermott, the chair of the SEB Board, deputy here at HCA. With board members attending both in person and virtually, it'd be helpful for the board to hold their question until each presentation is done, or when the presenter pauses and asks if there are questions. Board members attending virtually, we're going to be watching for your Zoom hand. There is one resolution scheduled for action today, so the public's going to have an opportunity to provide comments on the resolution during the normal procedure before board votes. The public is also going to be able to provide general comments at the end of the meeting during the public comment period. And as a reminder, if the public has questions during a staff presentation, the presenter's contact information is included at the end of the presentation, and the public is welcome to email the presenter during the meeting to capture a question or response after the meeting. Dave is not feeling well, and so he is at home nursing a fever, and Jean is going to be subbing for him today. Welcome, Jean. Is this your first time?
Nope, I was a facilitator last year.
You're a veteran. Over to you.
All right, thank you, Chair McDermott. For the record, my name is Jean Bowie. I am the Deputy Director of the IRB Division here at the Healthcare Authority. And an overview of the agenda for today's meeting. We will be bringing the meeting minutes from March 21st and April 4th for approval. I will be providing follow-up from a question during our April meeting. Ryan Ramsdell will be bringing a resolution on the UMP benefit design. And we have a substitute. Jessica Pratt McConnell will be providing an update on the benefits 24/7 project. And Michaela Snook and Missy Bruce will be providing some information on the agency's premium payment program. So some housekeeping info for those in the room. The bathrooms are down this hall and to the left on the opposite side of the elevators. And if we have an emergency, we will all gather in the visitor parking lot that is out that way. Back to you.
All right. Thank you, Jean. And we have a few folks joining us. Allison.
Good morning, everybody.
Good morning. And Omid.
Good morning, everyone.
Sir, did I get that correct this time?
You did. Thank you.
Outstanding. Good deal. We're making improvements here. All right. First up, we're approving the March 21st and April 4th meeting minutes. We're going to be voting on both sets of minutes. The meeting minutes are behind tab number 3. And Jean, is there a reminder about the March?
Yes, so we had a correction to the public comment portion of the March minutes. So we did not vote on those at the last meeting. So we're bringing them for approval for this meeting.
Awesome. Any comments from the board? Do I have a motion to approve the minutes as written?
So moved.
By
This is
this-
Myra, sorry.
You're good. Is there a second?
Pam Cruz, second.
All in favor, say aye.
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 Any opposed? March 21st, 2024 minutes are approved as written. Next up is the April 4th, 2024 meeting minutes. Any comments from the board? Do I have a motion to approve the minutes as written?
So moved. This is Myra.
Is there a second?
Second, Pam Cruz.
All in favor, say aye.
Aye.
Any opposed? Thank you. The April 4th, 2024 meeting minutes are approved as written. Jean, are we gonna do Dave's standard follow-up? Are you, the materials behind tab number 4, are we doing that?
Yes.
Okay, excellent.
So we had a question at the last meeting as to what the overlap is pertaining to dual enrollment between the PEB and the SEB programs. And so the information that we have on the slide is for a PEB subscriber who waives medical and is enrolled in SEB medical as dependent, 563. PEB subscriber waiving PEB medical and on SEB as a dependent but not enrolled in medical is 121. Then the converse on the SEB program is SEB subscriber waiving SEB medical and enrolled in PEB as a dependent, we have 1,205. And same scenario, but not enrolled in medical on the PEB side is 156. Are there any questions?
Thank you, Dean. Next up, we're going to hear about the UMP benefit design. Ryan Ramsdell, UMP team manager in the Employees Retirees Benefits Division, is going to bring us a resolution today regarding UMP benefit design changes for 2025. After Ryan reviews the resolution with us, we're going to ask for a motion to adopt a second. We're going to do public comment on the resolution. Then we're going to ask for discussion from the board until we're ready for a vote. Materials behind tab number 5. Ryan, welcome.
Chair McDermott, members of the board. My name is Ryan Ramsdell. I'm the UMP TPA team account manager. And I'm going to go over a resolution that was proposed at the last board meeting. Before I do so, I'd like to do some follow-up. So this resolution pertains to diagnostic and supplemental breast examinations. And there was a question as to why in the resolution we call out high deductible plans specifically. This is fairly routine, but the rationale behind it is that in order for high deductible plans to maintain their special pre-tax contribution status, feds and other regulations are very clear about basically a beneficiary paying for the first dollar for most services until they exceed their medical deductible. There are exceptions to that rule depending upon preventative services and so forth. Federal regulations or the federal guidelines stipulate can bypass that rule. So when you see us call out high deductible specifically, it's for that purpose. In this particular case for this resolution, because it is addressing an effort to provide a benefit that is diagnostic in nature and is not specifically called out in the federal regulations as being able to bypass that deductible, we have to stipulate that those individuals will have to meet and or spend most of their medical deductible before it'll go into play. Are there any other questions about that? All right. So a matter of clarification, there was a revision to the proposal that was brought in April. We were able to clarify that this particular resolution would apply to members both in network and out of network. So you'll see that there's a red line there for the in-network services. And if no further questions, proposed resolution is up and I will hand it over to Chair McDermott.
So, thank you, Ryan. All right, we're going to go ahead and vote on resolution SEB 2024-08 UMP diagnostic and supplemental breast exam coverage resolved the beginning January 1st, 2025. Diagnostic and supplemental breast exams to be covered without member cost share to the UMP members. UMP high deductible members need to meet their deductible before the plan will pay any portion of the claim. Is there a motion to adopt?
So moved.
Is there a second?
Second.
Do we have any comments from the public? None? Any comments from the board? All right, this is going to be a roll call vote starting with Carrie.
Aye.
Pamela,
Aye.
Omid,
Aye.
Donna,
Aye.
Amy,
Aye.
Mary. Myra,
Aye.
Allison. With us, Allison?
Sorry, I didn't unmute fast enough. Aye.
And Lou, yes. I think it's interesting how the first person gets to decide if we're going aye or yes or no.
I'm trying to think of something creative.
You got it. Resolution 2024-08 passes.
Next steps are to update HCA member facing material where it's appropriate. Also be working with regions to make sure their communications are adequate and that we update our systems so that it bills properly and the members receive this benefit. Nothing more.
Thank you.
Thank you.
Ryan's like, man, in and out. That was awesome. There you go. And Jessica, is she online with us or in?
Yeah, I'm online.
Hey, Jessica.
Hi.
I don't know your title. I
It's all
see
right.
the title. We were going to have an individual, Shatrina, was going to come and talk to us, but Jessica's pinch hitting. She is out of the office today. So Jessica Pratt, if you could introduce yourself. You're going to give us an update on benefits 24/7 and the materials are behind tab number 6.
Perfect. Thanks for having me. And sorry, I'm not in person. Like Lou said, I am filling in. My name is Jessica Pratt, and I am IT policy and planning, much like Katrina, and actually was able to serve as the project manager for benefits 24/7. So really happy to be here. And I'm going to go and dive right in. Next slide. The goal of the presentation is I want to provide an update on benefits 24/7 launch and share some of the successes and challenges that we've encountered since launching earlier this year. We want to keep you informed about our progress and the steps we are taking to ensure the project's ongoing and future success. We chose to launch in January to provide as much time as possible to stabilize before this upcoming open enrollment. And as we continue to work through stabilization, we are determined to deliver a high quality solution that meets the needs of our members and partners and the expectations of our stakeholders. The improved functionality that benefits 24/7 brings is resolving dual enrollment in real time with a shared database, the ability for members to enroll in or defer their retiree coverage online. It allows subscribers to initiate a special open enrollment, and for benefit administrators to view subscriber enrollment history, and then lastly, to review the wellness program participation as well. We acknowledge the impact of the issues that we've seen reported since January, including system bugs, data inconsistencies with our data migration, and other concerns that have been raised by partners and members. I'm going to list a few examples of issues that we've resolved since launch. The first one being we've corrected benefit administrators' ability to terminate employee benefits prospectively. We've made several updates to the MetLife eligibility file to use accurate termination reasons. We fixed enrollment dates for many newborns as they were added as dependents, and addressed several issues involving migrated dependent data that came from the legacy Pay1 system. Please know that addressing these challenges has been our top priority, and we are working to resolve them in a timely basis as they're provided to us. And next slide. As far as next steps, we understand the importance of a reliable service and are committed to improving the benefits 24/7 experience for both subscribers and the benefit administrators. We have implemented a comprehensive plan to ensure the system stabilizes and is able to meet the demands of this upcoming open enrollment. Our teams, in partnership with business, are actively engaged in prioritizing and addressing the reported issues, and we have already resolved numerous system items. As we move toward open enrollment this fall, our focus is and remains on stabilizing the system and addressing key functional areas to ensure a smooth and seamless experience for all of our users. We are also working on 2 large pieces of functionality for the PEB members that includes standalone vision and updates to UMP Medicare Part D. As far as support for benefit administrators, outreach and training, which is a unit in the ERB division, provides ongoing support and training via their normal means of communication. Some of the tools that they use for training includes, we have an open environment of benefits 24/7 where benefit administrators can go in and play around. They can input mock data, use it to understand what happens if you do this and any impacts that they would make and changes on accounts. They can use that in conjunction with user manuals that we've provided, so they can use the environment to actually walk through the steps they would need to do to be able to support their subscribers. ONT also provides instructional videos, which go over the overview of the system, how they can support and manage access, and then of course, working with their subscribers' eligibility, enrollment, and dependent verifications. There are a number of recorded webinars that are available, including Q&A sessions, and those range from April through May of 2023. As far as communications externally for subscribers, there's a May newsletter, which benefits 24/7 is mentioned and reminding people to set up an account in preparation for open enrollment. There will be an October newsletter. Again, benefits 24/7 will be mentioned and provides resources about the upcoming open enrollment and what changes they're going to be able to make. And then of course, the normal other open enrollment communications, such as our HCA website and materials provided at in-person benefit fairs. As far as communicating to benefit administrators, we provide project and application updates in April. So just this recent updates were sent out, and then we're going to continue to provide updates through those normal means throughout this year, preparing for open enrollment. And that is it for me. Any questions that I can help answer?
Thank you so much, Jessica. I appreciate the update.
Thank you.
All right. Well, we're actually scheduled for a break, but I don't, okay, I didn't think so. I was like, I'm still feeling pretty good. All right, next up, we've got Michaela Snook and Missy Bruce. They're going to be giving us an update on the premium payment program. And the tab, their materials behind tab number 7. Okay.
Sorry.
You're okay. We're ahead of schedule.
The calling.
Oh, the allergies, yes, they have been. And the little button in front of you turns on your light.
Good morning, Chairman McDermott and members of the board. For the record, my name is Michaela Snook. I'm the section manager of clinic finance and premium payment programs in HCA's financial services division. And with me here today is Melissa Bruce, program unit supervisor of the premium payment program. We're here today to talk about this program and the benefits that it has to clients who enroll. Today, we will provide you with information on the benefits of HCA's premium payment program. The premium payment program offers an elective premium subsidy for enrollees, including SEB and PEB program subscribers who have a qualifying member on the health plan who is also enrolled in Washington Apple Health, or also known as Medicaid. For the purposes of this presentation, we're going to use the following terms. Enrollee will refer to individuals enrolled in commercial insurance, for example, the SEB program. Client will refer to individuals enrolled in Apple Health and or the premium payment program. Some background on premium payment programs. Under Section 1906A of the Social Security Act, states may offer an optional premium assistance subsidy to individuals who are enrolled in both medical assistance or Apple Health Medicaid and commercial insurance, such as the SEBB program. These programs are commonly referred to nationwide as health insurance premium programs, or HIP, and are optional for qualifying Apple Health clients and their families. HIP programs generally have low enrollment numbers on the national scale. The intent of the program, or the premium subsidy, is to reduce medical assistance costs related to Apple Health clients who also have access to commercial insurance. Next slide. An overview of the Healthcare Authority's premium payment program. HCA's premium payment program began in 1989, so it's been around for a while. The program provides reimbursement for insurance coverage when an Apple Health client has access to qualifying commercial health insurance coverage, such as employer-sponsored insurance. The program helps Apple Health clients take advantage of commercial insurance in a way that reduces healthcare costs to the state's Medicaid program. HCA's premium payment program is a reimbursement program, so premium payment clients pay their monthly premium and submit proof of payment to HCA's premium payment program for reimbursement. Next slide. On this slide, I will provide an overview of some statistics for the program. Our most recent completed data compilation is from calendar year 2022. But I want to note before I go into the slide that in 2023 and going into 2024, the stats have remained the same percentage-wise. While we do have clients enroll or disenroll on a monthly basis, the numbers have stayed pretty much the same. So as of 2022, there were an estimated 1,163 households who had elected to enroll in the premium payment program. 14% of the premium payment program cases were enrolled in a SEBB program. And to size that, that's roughly 160 households. 7% had enrolled in or PEB subscribers, and that's roughly 80 households. 76% were enrolled in what we've defined as other employer-sponsored insurance, so not PEB, not SEBB. And 3% were enrolled in plans purchased off the health benefit exchange. And now I'm going to hand it over to Missy to present on some of the benefits to our subscribers and employees.
Thanks. Good morning, Chair McDermott and members of the board. My name is Melissa Bruce, and I'm the unit supervisor for the premium payment program. I'm going to go over the benefits to clients and some of the qualifications to qualify. So some of the benefits to the clients is that they can maintain both Apple Health coverage and commercial health insurance. By having commercial insurance, clients can gain a wider access to providers and services such as massage therapy, physical therapy, and they may also experience less wait time to make an appointment. The premium reimbursement may cover family members on the commercial insurance who are not Apple Health clients if it is determined to be cost effective to the state's Medicaid program. And I'll get into that a little bit further. Next slide. So program eligibility, the client must meet the following criteria to qualify for the program. They must be enrolled in Apple Health or have a qualifying enrollee on the health plan who is enrolled in Apple Health. They must have commercial health insurance that qualifies for the premium payment program, such as a qualified employer-sponsored health insurance plan, such as SEB Board Health Plan, or an individual health insurance plan purchased through the health benefit exchange, excluding any sort of premium tax credit. To qualify for the premium payment program, the commercial health insurance must qualify deductible amount to be cost effective. I'll go over that for 2024 as well. To qualify for the premium payment program, current in-network 2024 cost-effective deductible amounts must equal or be less than $1,600 per year for an individual. So that's the subscriber only. They would need to be on or under $3,200 annually for a whole family. Currently, all 2024 SEB Board health plans do meet the premium payment deductible requirements. Next slide. So non-qualifying health plans, the following health plans do not qualify for the program. A high deductible plan as defined in section 223C2 of the Internal Revenue Code, PED program Medicare plans, health plan purchased through the health benefit exchange with a premium tax credit, and an individual health plan that was not purchased through the health benefit exchange off the market. Any health plan that exceeds the annual deductible amount established by the premium payment program. So how we determine cost effective is HCA calculates the premium reimbursement amount using one of the following methods to determine cost effectiveness. Most commonly, HCA determines the maximum amount of the monthly premium reimbursement based on a calculation called cost effective amount, using the demographics such as age, medical program type, and county of the same client. HCA either pays the full premium or up to the maximum cost effective amount, whichever is less. In very rare cases, a client may request that HCA cover more than the cost effective amount after HCA performs a clinical review. If approved, HCA reimburses the additional costs related to the Apple Health recipient on the commercial health insurance, but not to exceed the total amount of the premiums being paid. So I'm going to give a couple of examples on how we determine cost effective and what those might look like. So a client enrolled in Apple Health and commercial insurance, the premium payment program determines that the maximum cost effective amount of the premium reimbursement for the Apple Health client is $250. The total premium amount of the entire household, 2 parents and 2 dependents, equals $200 per month. Therefore, the premium payment program will reimburse the household's total premium of $200 per month. Example number 2 is the same information. So premium payment program determines that the maximum cost effective amount for this family is $250. Same demographics, 2 parents and 2 dependents equals $300 a month. Premium reimbursement of the Apple Health cost effective premium amount of $250 per month. Therefore, that family's household premium responsibility would be $50 per month. So we would only pay up to that maximum cost effective amount. Enrolling in the program, enrollment in the program is optional. Enrollees who believe they qualify for the premium payment program must submit the required enrollment information to determine if they are eligible for the premium reimbursement subsidy. Enrollees must submit a completed premium payment intake form and an IRS W-9. It may take up to 30 days to process an application, and after the premium payment program receives all the necessary paperwork. Anybody have any questions?
I had a question. Is there a notice that goes out to folks letting them know about this program?
There is.
Okay, we do that once a year.
We do. SEB, the SEB program does that, and so does the PED program.
Awesome. Other questions from the board? Donna?
Yes. What is the turnaround time on the reimbursement for the premium amount?
Yes, our staff is really up to date and current with that. So if someone gets us something, we're relatively quick about it. We have 30 days to process a reimbursement, but it's really routine for my staff to be turning it around in 2 business days.
Got it. And so each month the person would have to do that though, right?
Yes, each month they would send us a copy of their pay stub showing that the payment had been withdrawn from their wage stub.
Is there any way that can be automated?
The payment?
Yeah, because I mean, I guess you'd have changes that would be made though that possibly, I mean, it's just a reimbursement that they don't send anything else other than a copy of their paycheck stub.
Correct. And the reason that it can't be automated is just, you kind of answered the question yourself. If their like Medicaid eligibility terminates or there's a change in their coverage program through Washington Apple Health, that may change. So we do it every month and we actually we manually process those payments.
But you would have access to that information on your side because you would check that if all they're sending you is a paycheck stub, right? You're not asking them during that time if anything changed, or is that
No,
a question that's asked each month?
It's not a question that's asked every month. We look at that in our Provider One system.
Okay,
But
so,
it is a reimbursement program. So the reason we don't do it automated is because we wait to get that wage stub from them, showing that they've already made the payment.
got it. Okay, thank you. Because this is something I can see in our classified world that would be more prominent than in our certificated world. So I just want to have all that information to talk to my members.
Other questions? Omid?
Yeah, so I had two questions, but I think you could answer them together. Is one, could you give me an example, just because I'm not quite clear on this, of when someone would be or a household could be eligible for a PEB or SEB program, but also have household members eligible for Apple Health? Because I'm curious when those situations occur. And then the second part is how many members of PEB and SEB are actually eligible for this type of service, and maybe if there's like a gap analysis of those who do and do not enroll in it.
Yes, absolutely. So how, sorry. So how you could potentially have access to private insurance through the SEB program and have members on Medicaid is you could have a child with a disability. You could have a large family, so you could still meet the income guidelines, or you could have a foster care situation where the child has Washington Apple Health, but you still have access to that SEB program. And then as far as knowing how many people qualify, we don't know that because it's not a mandatory program. So we don't have that access to that kind of data.
Okay, gotcha. So the healthcare authority and then PEB and SEB don't have access to see if people are dual enrolled or can do linkage between them to see if we are missing people who could benefit from this program?
I think I see where we're going with this. We wouldn't know what the spouse is doing. So the whole
Gotcha.
household income, the individual who's working for PEB and SEB, we might be able to see their salaries and realize they do technically qualify under their salary alone, but we don't know what their spouse is making if there's a spouse involved. And so I think that would be the answer, right?
Part of
I
it.
guess.
Yeah, I think that's part of it. We don't really know people's individual situations. And I will say this is an elective program and people self-select into the program. So I think our approach is to get the information out there so that people have that information. But we do see people who are interested and then decide not to enroll because it's not what's best for their family for a full array of reasons. They might just want to maintain only Medicaid coverage for the child or the dependent. So I think our approach has not been to try to target folks who are both enrolled in SEB and Medicaid, although we probably would have that information. We haven't taken that approach.
Okay, gotcha. I'm just curious because just from this, the first time I'm hearing about this, sounds like a net benefit if you're able to enroll in it, but it sounds like there are situations where people might decide to stay enrolled in one or the other. So thank you for your answers.
Other questions?
This is Donna again.
Oh, hey, Donna.
This is a cost savings to our state though, correct? Because that premium actually the payment comes from the federal government?
Yes, it's a savings program to the state's Medicaid program. That's how it's permissible under the Social Security Act. And yes, it is partially federally funded based on the client's Medicaid enrollment information.
Got it. So it could be made possibly more of a priority than to try and find those families that could benefit from this. For me, foster care is another one, like you said, that I know we've got teachers who has foster kids and they may not know this program's available because that form comes through once a year. I have seen it. So, all right. Well, now I know to have people start watching for it.
Great. Thank you very much. If there's no other questions, I'll hand it back over to Chairman.
Any more questions? Thank you. Appreciate it. We are at public comment. If anyone out there in Zoom land would like to provide comments, please raise your hand. We'll go ahead and collect the names and then we'll get you lined up. Seeing none, we're going to, Ligori. Are we pronouncing that correctly?
Hi. Yes, that's correct. Can you hear me okay?
Yes, we can.
Hi, good morning. Thank you so much for taking my comment. It's a question as well, and whether or not as benefit administrators, we need to reach out to our outreach and training group. Unfortunately, this is the first we've heard of that training environment. We think that would be really, really helpful for benefit administrators in the state, and we're hoping to get more information about that. Are there links or resources that we can have or we can share to make sure that we have access to that?
So we can have the our outreach and training folks send out information via the Gov delivery system to the benefits administrators on that training environment.
Thank you.
Nancy, any other? Okay, that's it for public comment. Our next meeting is going to be June 6th, 2024, starting at 9 a.m. We're going to use the same format, in person or via Zoom. Do we have any, do you want to go over the next agenda?
We do. We're rolling into our rate setting season, and so we will have an executive session with status of the 2025 rate negotiation process. We'll also be bringing you an update on the Medicare work that we're doing in the PEP program, and working on some other topics of interest too.
All right, thank you. Well, Jean, you have bragging rights now, a 37-minute. We got to talk to Dave about this. What is Dave doing? Very nice job, Jean. Appreciate it, and all the staff work that goes into these presentations. Board, thank you for being down here. Appreciate it. Board members, thank you for zooming in, and everybody have a good day. We'll see you next time. This meeting's adjourned.